The coldest air of the winter may visit West Michigan this week. It's already cold and snowy out there. Dr. David Rzutko, Vice President of Medical and Clinical Operations at Priority Health, is here to remind us about the dangers of the cold and what we can do to better protect ourselves. Dr. Rzutko, thank you for joining us.
Thank you for having me, Amber.
Yes, such a timely topic. Important reminder for all of us. A lot going on this week. Let's first talk about what are the biggest safety risks people face during West Michigan winters.
Yes, ice, snow, lots of slippery conditions. We see lots of falls, strains, sprains, fractures because of going down on the ice. When temperatures get this extreme into the single digits and below, we also worry about thermal injury, so frostnip, frostbite, or hypothermia. And then we definitely see an increased cardiovascular event rate because people are out snow shoveling or just overexerting in the cold.
Yeah, we've been busy shoveling this snowy season, very busy. So how can shoveling the snow lead to a potential cardiac incident?
Yeah, so in the cold, we've already got a heightened cardiovascular response, right? We've already got an increased stroke volume, heart rates go up, blood pressure raises because we get that peripheral vasoconstriction. And so there's already that cardiovascular response, coupled with the fact that snow removal itself is a very physically exertional activity. It's oftentimes underestimated in terms of the actual impact of how much physical capacity it takes to actually remove snow. Certainly snow has different weights to it as we are moving it, but those two factors together really can predispose towards increased cardiovascular event rate.
I know when we go out there, sometimes we just want to get it done, but it's so important to take breaks. I know for myself. What are some precautions people should take to reduce, increased risk when shoveling snow?
Yeah. So the first thing is just prepare for the cold weather. So being proper clothing, making sure that you're wearing a good hat, you've got gloves on, maybe a face covering, making sure that you're keeping the skin surfaces that are exposed, so that way it prevents things like hypothermia and frostbite. Pacing yourself when you are shoveling, right? So making sure that you don't have to go out there and hit the whole driveway, maybe go out and take some breaks for yourself. Also, as I mentioned, the actual weight of the snow itself can vary depending on the moisture content of the snow. We sometimes see that beautiful West Michigan powdery snow, but then we can also get really, really heavy laden snow. And it's going to vary depending on the weight of your shovel and the weight of each shovel full. So possibly pushing the snow or using a shovel that will allow you to push the snow rather than trying to lift it. And then thinking about the ergonomics, thinking about your back, lifting with your legs, not with your back to prevent injury in that respect. And so just some of those gentle reminders of some of those little small tips can really prevent and stave off injury or illness resultant.
And Dr. Rzutko, as we know, falls are one of the most common winter injuries. What prevention steps really make a difference?
Yeah, so as we mentioned, clothing and footwear, so very, very slippery times. Just putting a good pair of shoes that's got a good skid-resistant sole to that. You've heard the saying about walk like a penguin, is where you're kind of shuffling the feet, not actually with a usual gait. If you do need to use some type of assisted device, that's probably also not a bad idea to use either a cane or some type of a walking stick if you are encountering slippery roadways, sidewalks, particularly stairs when they do thaw and freeze in those cycles. And so taking some precautions are really an ounce of prevention is definitely worth it.
All right, Dr. Rzutko, anything else that you want to share?
Yeah, Priority Health has a ton of resources regarding this as well as other health-related conditions, and you can always reach us at priorityhealth.com and stay safe out there in the cold.
Yeah, absolutely. Dr. David Rzutko with Priority Health, thank you so much for joining us.
My pleasure. Thank you.